Hey everybody, welcome back to Men Need to Be Heard. I'm posting this video during a very important time. I'm posting it during Men's Health Week, and I want to talk to you about it. So in case you haven't heard, this week is officially Men's Health Week. It's intended to raise awareness about preventable health problems that affect men and boys, and to encourage early detection and treatment of disease. And you'd be forgiven for not knowing that it even existed, because it gets a fraction of the attention that other health awareness weeks receive. Not only does it not get any attention, but those of us who've tried to bring it up get silenced. Earlier this week, while doing Boy Meets Squirrel, a show where we talk about men's issues, and in this particular case, we're talking about men's health and specifically men's mental health, TikTok took us down. Well, more precisely, they said we were talking about something that makes people feel uncomfortable. And thus, while they didn't cut the broadcast off completely, they stopped showing it to others, so only those who were actually watching it at the time could continue to see it. Let that sink in. TikTok, as a company, has a policy and is openly stating that talking about men's health or men's mental health is a violation of their terms of service because it makes people feel uncomfortable. Now ask yourself, do you think they'd do the same thing if we were talking about, say, breast cancer? Not a chance. And when you compare June being Men's Health or Mental Health Month to October's Breast Cancer Awareness Month, the differences are striking. Breast Cancer Awareness Month is a massive, well-funded, culturally visible movement that's helped improve survival rates and destigmatize conversations about women's health, which I would venture to say men in general, overwhelmingly support. Yet, when it comes to men getting the very same level of public concern, suddenly it's uncomfortable. A community violation, something that not only shouldn't be addressed or any funding given towards, but silenced. The question you might be asking is, why don't they get it? And the answer, my friends, is they do. Oh, they most certainly do. They know exactly what they're doing. This isn't an accident. It's a deliberate, planned, coordinated program to silence men and talk about the issues that they face. Make no mistake about it. It's across society and it's becoming part of our culture. A major reason why men don't seek help and why they don't talk about their struggles is cultural conditioning. Men are socially conditioned, literally from the day they're born, to avoid seeking help, especially for emotional and mental health struggles. Phrases like man up and real men don't cry or rub some dirt on it have kept generations of men silent about depression, anxiety, and the traumas that they face. When men do finally reach out for help, the services available to them are often limited or actually geared towards women. Or they're told to sit down, shut up, and stop taking away from women and their issues. Something someone came on the broadcast we were doing the other day and actually said. The likelihood is that person then went and reported us for talking about it and ultimately got TikTok to shut it down. Which again is why men don't speak up. Add to it, many men don't feel comfortable in conventional therapy spaces, nor should they. Those spaces have become so toxic, so full of an anti-male mentality, one that's been ingrained into the mental health field, it simply isn't safe anymore. The mental health field is already 70% female and quickly headed towards 90%, and they have no love, no caring or concern about men or their issues. And it's not just mental health. Resources for male-specific physical health issues, things like prostate health or testicular cancer, remain scarce at best, a mere fraction of those that are provided for women. And even in the mental health advocacy spaces, male unaliving is underaddressed, despite the fact that men make up nearly 80% of those deaths. And ignoring men's health issues doesn't just hurt men. It hurts families, children, workplaces, society and communities, and ultimately, even women. When men fall, everyone around them falls with them. Here's the reality that exists, the one that most people don't want to talk about or even acknowledge. Men are more likely to die from heart disease, cancer, and liver disease than women are. Men are less likely to visit a doctor for regular checkups, mostly because they know they're going to be shamed and laughed at if they do. Men suffer higher rates of workplace injuries and deaths, to the tune that they make up over 90% of them. And men's mental health, well, it's laughed at, widely overlooked, and results in men often having no choice but to try and self-medicate through drugs, alcohol, or through other unhealthy coping mechanisms and risky behaviors. And they face all of that while being told if they wanted to fix it, they could, while at the same time being told if they do try and fix it, they're somehow taking away from women and their issues. Many of these risks that we've talked about are preventable or treatable when caught early, but the combination of stigma, poor outreach, and lack of targeted resources leaves men vulnerable. The reason women outlive men by 5 to 8 years now isn't because of biology. It's because of systemic, global planned initiatives to make it that way. So what can we do about it? Well, for one, men need to stop staying silent. We need to speak up and say, we're not going to be ignored anymore. Awareness is the first step. If we don't start talking about our health, about men's health, and make it a priority, especially during weeks like Men's Health Week and beyond, nothing is going to change. We need to normalize and allow conversations around things like mental health and unaliving prevention, prostate, testicular, and colon cancer screenings, cardiovascular health, substance abuse treatment that needs to be tailored for men, and the big one that no one really wants to talk about, that male victims of domestic violence exist and the traumas they face are every bit as bad as those of female victims. We also need more male-specific outreach campaigns, ones that meet men where they are, using messaging that resonates with them instead of demonizes them. Community initiatives, social media campaigns, and public health programs should treat men's health with the very same urgency and visibility as women's health. But here's another thing, and men, I'm speaking directly to you. Your health is your responsibility. And you're right. If you're a man listening to this, take this as a reminder. Your health matters. You matter. And you need to do this not just for you, but for your family, your friends, your children, your future. Get up and schedule that checkup. Talk to someone about what's weighing on you. Check your mental health. Get screened. Open up to a friend and be available so they can open up to you. Doing all of that is not weakness. It's strength. And this week is the perfect time to start. I asked men during the show earlier this week, when was the last time you had a physical? And actually, I was heartened to see that many of the men had had one in the past 2 to 3 years. But my friends, that's not enough. You need to have one every year. You need to be screened for prostate and other cancers. You need to get your blood work done. Yeah, it's a pain in the ass. Sometimes literally. It's not fun. It's inconvenient. But it's something you must do and do today. And I'm challenging you, if you have not had a physical in the past 12 months, right here, right now, go pick up the phone and schedule one. Don't do it for me. Don't do it for your children or anyone else for that matter. Do it for yourself because you do matter. All right, I want to hear from you. Do you feel men's health issues get the attention they deserve? Why or why not? If you don't take care of your health, why? Why do you ignore it so much? Drop your thoughts in the comments. Let's talk about it and shine a light on this issue together. Let's help hold each other accountable to making ourselves and all men a priority. Because doing so doesn't make us lesser as a man, it makes us more.